But I like to put my guests on the hot seat. So I have to ask, is there anyone that you have endorsed, that you have your eye on from the Democratic side? Or is that something you don't mention?
So It's not that I don't want to talk about it. It's that I haven't made up my mind yet. The thing is that politicians, as much as I might like a politician, that's still a politician. I might feel really strongly about their stance on, civil liberties and personal freedoms, but maybe I think they're kind of a warmonger, so it's hard for me to make a decision at this point. I wouldn't abstain from talking about my decision. I just haven't made one yet. I just don't know
sense.
Yet.
On that same, I just want to know, because for me, my biggest issue is Medicare for all. I don't know how much you know about Medicare for all versus our current and health insurance versus Obamacare. Like, I don't know how much you know about that.
A fair amount.
I love that stuff. Like, I knee deep in policy. I love all that stuff. Do you think that as a nurse, as a healthcare professional, do you think that Medicare for all, a single payer system for the U.S., is a good way to go? Or do you think we need private healthcare insurance? Do you like the current situation we have right now?
I think that privatized healthcare, excuse me, I have to adjust my chair. I think privatized healthcare and privatized health insurance is literally killing people. It is literally causing people to ration their insulin, skip their meds, avoid having necessary procedures. That's also, I think that a lot of these things are so intertwined that it's hard to piece them apart. I think people not having health care is why emergency departments are overburdened, which is why people are not getting the emergency care that they need. Our emergency room at my hospital holds like 160 some people. I might be off on that number. The other night, they had 250 people in their waiting room. They have people that are intubated, ventilated, people that don't have emergencies. They have to see them all because we're essentially a state hospital. We can't turn people away. Yes. But also, our governor has repeatedly turned down Medicaid expansion, has cut mental health services. So now you see more people in emergency departments because they don't have health care. They don't have preventative health care. They don't have prescription management. They can't catch shit early. So they come in when the cancer is like busting through their skin because they're scared because they had
I love that when you say that, because I don't think people understand it. And a lot of people, outside of how much it's going to cost, a lot of people say once we have Medicare for all, the waiting lines are going to be forever long. But they don't understand that.
They're long now.
And
people say, like, I don't want to wait 50 years for an MRI. Motherfucker, I can't even get into my primary physician for 3 months. Who do you think's not waiting?
See, and that's the thing, because people don't understand that when people don't have health insurance, they don't go in for the stuff that they could prevent. They don't go in to stop the bleeding, right? They go in at the absolute last minute when it's like shit hits the fan.
They go in when their leg is necrotic and they're in DKA, and they tell you that they haven't been able to afford their insulin for 4.5 months. And you're like, well, no wonder.
Of course.
So I am for socialized medicine. I think that all of the arguments, the typical knee-jerk reactions that people have are either already happening or are just simply not true. And I think if we look at other industrialized, successful, financially successful nations with happy people, you will find that, like I saw a meme the other day that both made me laugh and made me really angry. It said something like, it was like a pro-gun post, and it said like, well, I own a gun because if I ever need to put my kid on a flight for a kidney transplant, no government is going to tell me I can't. And then the bottom underneath, somebody had replied, so you're saying you would hijack an airplane to go to a country with socialist medicine so that your child doesn't die? Okay.
Right?
You go to a socialist country if the government fails, but you won't be a socialist. And here's the thing. We're already a socialist democracy, essentially. Like my partner right now is in library science school and he works in a public library. The public library now has become like, libraries are hiring social workers and librarians are functioning as social workers because we have mental illness that leads to homelessness. People don't have resources. The libraries essentially become a hub for people that have mental health issues, and they're constantly dealing with these things. And they're not healthcare providers.
Librarian?
because he works at a library. He's a librarian's assistant, and he is in grad school for to be a librarian. And people are like, oh, when you shelve books? No, we're talking. We have the public library system, and I don't want to get off into that, but it's similar to nursing. Like there's 800,000 different kinds of librarian you could be. Same way with nurse. You can be a clinic nurse. You can be a bedside nurse. You can be a nurse practitioner. You can be a research nurse. It's the same way. You can be an archival librarian. You could be public school. You could be public service. I mean, so I guess the point that I'm making is that these industries that we don't think of as healthcare industries are being forced to do healthcare-like things because people don't have anywhere to go. Like they closed all of our mental health facilities. Yeah. And so you have people that have mental illness that are now homeless, incarcerated because exactly. I've taken care of patients who had to divorce their spouses of decades because they needed health care and they couldn't get it with their spouse's income. There's a woman that I interviewed here in my state. Her husband lives in Illinois because the only place her insurance company would cover for her to receive skilled care was like 3 hours away. So she doesn't see the family anymore. And they can't afford to come see her every day. Who drives 3 hours, 6 hours a day to see their family member? So all because she couldn't afford, like she wouldn't even have insulin or her incontinence briefs covered if she didn't do that. It's like, what the fuck are we putting people through over some political argument? That's because people are like, I earned my money, it's mine. I don't care if you die.
That's crazy. And the cherry on top, the kicker is that it will end up being financially better for the country, right? Depending on how much you make each year is different for each like individual, but for the country, Medicare for All does.
And it doesn't hurt people. Like, you know, people say like, well, I'm not paying in so that I can pay for your abortion or your birth or your aesthetic, your nasal septum deviation repair. Like, people are like, I shouldn't have to pay for that. Okay, well, you're required by the state to have health or car insurance. If you don't insure your car, there are consequences for that. Exactly. And you're paying into a pool of money that's used to pay out other people's accidents. But it works because it all balances. The problem is when you have these companies that are making money off of denying claims and off of pushing pharmaceuticals. So the system, it's not just going to be like, oh, let's get socialized medicine. It'll be fine. Because a lot of people are going to have to let go of some really big bank accounts at the expenses of poor people, essentially. And, you know, people say like, oh, well, they don't take care of themselves. They deserve to have health problems. They don't. You know what? I could go right now and buy a bag of Cheetos and a Pepsi and have more quantity of food than if I go and try to buy organic vegetables. Right. Our system is set up that in every direction, people are kind of screwed, especially if you don't have resources. If you have resources, cool. You were born to a family that you weren't born into poverty, or you were able to work your way out of poverty or whatever. But there are some people that it's like they can't get ahead. It's like, you know, you skip your insulin because you don't have your $200 or whatever it is for your insulin. Now you've got $150,000 medical bill because you went into the hospital with a blood sugar of 750. Exactly. Who are we helping? Who's winning? Saving?
Like, yeah, exactly. Who's winning outside of the pharmaceutical company that's making, you know, insane amount of money on this drug that they just increased the price by 110%.
It's like there are politicians in my state that want to take healthcare away from nurses in my facility. They want to lessen our coverage, make us pay for it. Ridiculous. It's like I'm exposed to so much risk, disease, violence, injury. I've been injured multiple times, and you're telling me you want me to do this while paying for my own fucking health. Like, you don't even want your healthcare workers to have healthcare. Like, what does that say about the system? Like you only want the people who can afford to pay out the ass to have healthcare so that, you know, whatever medical company, insurance company can make a $3 trillion profit.
Go fuck yourself.
Yeah. If we had that many cats, we'd be pathologized and put away. You have that many dollars and you're exalted as a fucking genius.
Right. But
sorry, I got real opinionated.